This video is created for physiotherapy education and learning purposes only. The demonstrations and/or explanations are as per our experiences and are generalized and may not be appropriate for every patient or condition which is more specific. This content should not be used as a substitute for textbooks but just as an aid to formulate answers better.
Hi, I'm Dr. Ravina Kini, and today we are going to discuss about rheumatoid arthritis based hand injuries and deformities in this particular video. Before we proceed, let's look at the most commonly asked questions in the university papers. So rheumatoid arthritis is very frequently asked with regards to deformities in hand. So they've asked it as a 7 marker also. They've asked individual deformities under the subset of rheumatoid arthritis under 3 markers, like they've asked swan neck, they've asked boutonnieres, okay? And they have also asked people to write notes on the joint protection techniques. Now, before we discuss how to write an answer, let's unravel each and every deformity that comes under the subset of rheumatoid arthritis based hand injuries. So the most common one, as we can see, is the swan neck deformity. So if you can see the picture here, there is a hyperextension of the PIP and there is flexion of the MCP and the DIP that you can see here. Flexion of MCP, flexion of DIP. So basically the whole reason that it occurs is because there is a contracture of your intrinsic muscles. So the volar plates that lie here, they kind of get stretched and torn if the case is more severe, and that causes a swan neck deformity. So as you can see this, the deformity resembles the neck of a swan, and that is how it got the name swan neck deformity. The next common deformity of rheumatoid arthritis of hand is the boutonniere's deformity. So let's look at the image first on the right. So you can see that it is causing a flexion at the PIP, but there is an extension at the MCP as well as the DIP. So as this image you can see it is the reverse of a swan neck deformity that already we have discussed before. So it basically occurs because there's a rupture of the central band or slip, the extensor tendons insert here, the central band. So if there's a rupture of this, the lateral bands kind of overact and then they pull the finger into this particular deformity. So usually in the advanced stages of rheumatoid arthritis, it is visible in the fingers. The next deformity that we are going to discuss is the zigzag deformity. As you can see the picture here, it occurs in the thumb. And what we see is that there is the carpometacarpal flexion followed by hyperextension of the MCP, and there may be a flexion of the IP. Now, as we know, thumb only has an IP, no PIP, DIP, a single IP. So there may be a flexion of this. So if you see this image, it looks like a Z. So it is called as a zigzag deformity. Now, because there is flexion somewhere, there's extension somewhere, again flexion somewhere, the muscles undergo a lot of imbalance, and wherever thumb is involved in grip making, except hook grip that is, there can be affection of the grip strength that can occur as a consequence of the zigzag deformity. And if you let this disease advance and you allow the deformity to progress, there can be some sorts of subluxations and dislocations of the metacarpal of the thumb that can be seen in the future. We can also see an ulnar drift of the fingers and the radial shift of the hand as seen in the image on the right. So basically this occurs because there is a weakening of the capsulo-ligamentous structures of the MCP. Okay, now because the hand goes in a zigzag pattern again here, there can be an alteration of the length tension relationship of the muscles, because somewhere it is getting stretched, somewhere it is moving laterally, somewhere it is moving medially. So therefore that will eventually affect the gripping ability of the hand. Moreover, you can also see subluxation of the carpals if you allow this particular deformity to progress in hand. So rheumatoid arthritis also presents with something called as rheumatoid nodules, which you can see in this image, which are bumps that are found generally over pressure points, like in this case the knuckles. You can also see them in elbows, heels, etc. They're movable under the skin, and you can see that the size varies. They can be as tiny as in few millimeters or they can be as large as in few centimeters based on the advancement of the disease. An important aspect that is always asked is the principles of joint protection. As we know that rheumatoid arthritis has the joint deformities which keep on advancing if they are not taken care of. So what are the protective mechanisms that we can advise to patients to follow? So one thing is we need to monitor and pace the activities. That means that you do not continuously keep doing activities. You make some fast-paced activities, club it with a slow-paced one, give optimal rest pauses, okay? Coordinate with breathing patterns, like, do a movement while inhaling and relax while exhaling, something like that. Instead of doing a long bout of exercises, do shorter bouts of exercises, not everything all together. Avoid deformity based positions. Any position that puts you in a deformity you need to avoid. And if the person has developed deformities, they can go for hand braces. Okay, so always compensate for larger joints over smaller ones, because rheumatoid arthritis affects the smaller hand joints. Okay, so if you can see the image, they have advised that instead of using one hand, you might as well use both hands. Now if you can look at the left, what they're saying is that, instead of stirring using the wrist and fingers, you can stir using the shoulders by gripping in this manner. Okay, you, instead of holding it in the hand, you can hold the bag on the shoulder. Okay, instead of lifting the cooker in one hand, lift the cooker with both hands. Instead of wringing the clothes with this way, twisting the wrists, you wring by first twirling around a sink or something and then twisting the clothes to wring the water out of it. So rather than moving your wrist in a particular fashion. So you can follow these basic principles of joint protection to prevent further deformity. Let us discuss the splints that are used in rheumatoid arthritis based hand deformities. So you have swan neck deformity, which is generally managed with silver ring splints in this manner, that helps in relaxing the PIP as well as the DIP and MCP. You also have thermoplastic splints like this, which are custom made gutter splints. They have the Velcro straps like this to maintain the finger in a straight manner. Now, these thermoplastic splints can also be used for cutaneous deformity, and the silver ring splint can also be used for cutaneous deformity. But as the deformity is just the opposite of the swan neck deformity, the silver ring splint is also worn in a opposite manner, okay, in the way that it is shown in this image. Now, for the deformities of the fingers and the radial shift of the wrist that we have, the drifts and the shifts, we can have resting splints which are custom made from orthotists based on the degree of deformity that the person has. One very important condition, which is also an inflammatory condition in itself and occurs most commonly in patients with rheumatoid arthritis, is trigger finger. So as you can see in the image here, you can see that there is a thickening of the tendon sheet, which is why the movement of the tendon inside the sheet becomes very difficult. So closing and opening of fingers becomes problematic. It can be associated with snaps or pops that you can hear, and generally there is pain at the base of the finger, that is at the A1 pulley level, and you have the grades that are there. Now if you see the grades, initially at least you are able to open the finger with slight difficulty, but if you see grade 3, it becomes very difficult, so it can only be passively corrected. But grade 4 is where there is a fixed flexion contracture or deformity that develops, where you cannot open or close actively or passively. So that is why this has been included inside the deformities of hand, and it is, since it is seen most commonly in rheumatic hands, it is mentioned here, and it would definitely fetch you better marks if you add this in your answer. Let us now see how we are supposed to write answers in a structured format. So first of all, we need to read the question, see the marks that are allotted, deal with each deformity in detail, and if possible, make a flow chart or a box or table in that manner wherein you can put columns of deformity, description, complications, basic management like the splint or the joint protection, and a diagram if possible. So if you make it in this systematic manner, it's easy for the examiner to understand that you know the topic well, and it's easy for you also that you do not miss out on any points. Okay, just make sure that you add wrist deformities as well, because we always talk about finger and then we forget the wrist. Okay, so that's all about the deformities in hand in rheumatoid arthritis condition. So if there are any queries, please feel free to put the comments in the comment box, and then I will try to answer those as much as possible. Thank you for watching.